Mental health and wellness, big buzzwords, specifically in the last 20 months. What's up and welcome to the Fervent 4. Did you know that only 4% of businesses ever cross the annual $1 million revenue mark? Hello, I'm Zack Miller, author of Anomaly. With me today, I have my co-host, Tim Ryan, lead man at StartWheel.org. Thank you so much for joining us. The Fervent 4 is a weekly show each and every Thursday at 11 a.m. dedicated to sharing insights into growing a world-class business no matter the climate. We're joined today by Dr. Cynthia Romero. She's the director of the Brock Institute over at EVMS. Hello, how are you?
Welcome. Hello, I'm fine. Good morning.
You know, the last 20 months, COVID specifically, I think, mental health, wellness, it's unfortunately, I feel like it's gotten a lot of the back burner, hasn't really been on the forefront of a lot of stuff yet. Maybe in the last 6 months or so, it's really starting to take things pretty seriously. I can think back, and Tim and I have talked about this since we started the show back in March of 2020, that just because the world is saying stay inside doesn't mean stay inside. And a lot of times things that can be really important from mental health and wellness is getting out, going on a walk, maybe going on a run, getting on your bike. And so many people were just like, no, I have to stay inside. And so when you were going through that, you know, back in March of 2020, I think everyone was a little terrified of like, what is actually going on? But knowing that the things that you do on a daily basis, mental health and wellness, and we're getting people that are just going to sit for all day and not get out, not get any vitamin D, any of that. Like, what was going through your mind when you were hearing stuff like that?
So many things were going through. And if we can all remember what we felt like in March of 2020, there was a lot of uncertainty and fear and anxiety about what is this global pandemic, and the fact that it was, the word that really was resonating with everyone was that this is unprecedented and first time we've seen it in years, and the tremendous impact that it was having across the globe. And so I think with that just being so I guess truly unexpected and uncertain how long it was going to last and really what was happening, and just the difference in information coming out was causing a lot of anxiety for everyone. But I think what we also were seeing were that the people who were already struggling with everyday challenges mentally, emotionally, were starting to have even more significant issues because of all the strategies that were being promoted to help keep people safe from the pandemic, like staying at home, being separated, and being distanced from everyone and wearing a mask. And I think what that did was started to force people into this disruption of our social norms, our connectivity as human beings, from the workplace to family to friends and just everyday life. And that really put a lot of strain on everyone, not just those who had mental, illnesses before the pandemic, but certainly everyone across the board was experiencing something. So we at EVMS, and certainly all of our partners across the region, started to feel that impact really immediately. And so many of us who were working already before the pandemic and trying to help dispel the stigma of mental illness and addiction, substance use before the pandemic, immediately came together and started to say, what do we think people might need in this time that everyone is being asked to stay at home and to do remote learning, remote working, etc. And so we started gathering data and information and resources from across our region, across our state, across the country. And we were able to gather websites, phone numbers, and just information that were helpful for people to access remotely. And I think that was something that we felt was very helpful. And then as the time has gone by and more information came out, I think what we're acknowledging is that as people were starting to prepare for the next world after the pandemic, it was finished, what is that new norm going to look like? And what are the expectations going to be for the environments where people are going to find themselves in again, for work, for faith, for families, for social activities. And so I think that's causing some concern and some additional anxiety, fear, and uncertainty as to what that's going to look like, and who's going to be able to help, not only with the usual, let's cope with this, let's learn how to support health and wellness in everyone, but also to be able to reach out and engage those who are probably suffering even more and falling through the cracks, that are more disconnected than ever. How do we assure that we are, accessible and reaching and engaging those who may not be in touch with some of these systems already?
In terms of the data, I'm sorry, Zach. In terms of the data that you were collecting, what was the most surprising thing that you had found, and what did you do with that information?
Yeah. So when we were looking at some references, Mental Health America is a national organization that before COVID 19, we're already making available these surveys, right? And these various questionnaires for people to take if they thought they were suffering from some anxiety conditions or even depression. And what we found were there were hundreds of thousands of people that started to take those surveys, mainly because they were exploring and seeking ways to address some of the anxiety and the depression that they were feeling. And what we found was that, for anxiety, for example, over 300,000 people from January to September of 2020 took those surveys related to anxiety. And then over 500,000 people took the survey related to depression. And looking at each of those areas, 8 out of 10 people who took those surveys already exhibited moderate to severe symptoms that were seeking additional supports and services. So what we did with that was we turned to our partners within our region, and that included our community services boards. It included our hospital systems. It included private practices of psychologists, psychiatrists, and our nonprofits that are supporting illnesses within the mental health community, such as the National Alliance on Mental Illness, nonprofits who were serving by providing some mental health counseling. And we raised the awareness, and what they were able to do was to continue to promote in various venues that they had services available if people needed them, and having the phone numbers and the websites available so that people who were suffering themselves, or caregivers of those who were suffering, or coworkers or neighbors that were suffering, knew who to turn to. And I think that has been very helpful to be able to really activate those networks of resources. But what we've seen is that we still have a lot of work to do through various venues wherever people find themselves. So whether those be within common places like the grocery stores or pharmacies, or gymnasiums, or faith-based organizations, or other social organizations, and other cultural businesses and cultural organizations, what we're finding is that we are learning from public health practices in the past, where in order to reach people, we need to go to where they are. We need to go directly to where they're living, where they're learning, where they're worshiping, and where they're playing and spending their time, and be able to assure that they have information that is customizable for them, that it is at the reading level or the processing, literacy level for them to be able to access, but also to assure that they have the support from others around them, that once they get into some of these strategies, if it's something mild where they just need information to have self-care and know the exercise, the nutrition, the sleep, the drinking of water, the mindfulness strategies that we know of, that's fantastic. But when there are more serious conditions such as severe anxiety, severe depression, major depression, or even some of those serious mental illnesses like untreated or undiagnosed schizophrenia or bipolar disorder that need additional support that they get connected to the appropriate services and programs that are needed. So this is something, a topic and a process that will need to be strategically addressed for our entire community in the near and distant future, even as the pandemic subsides, and even as we're looking at, a world without a pandemic over the course of the next, year or so. This is something that we all can come together with and start to talk about. What can we be doing individually to take care of ourselves and keep ourselves as mentally and physically healthy and well? But also, how do we help support and create safe spaces for our family and friends and neighbors to feel comfortable and safe to express where they may be suffering?
It seems that getting your endorphins going is incredibly powerful in fixing some of this stuff. I'm not a doctor, I'm not a scientist, but it seems like when you sweat a little bit, when you get those endorphins going, it helps a ton. Do you guys see that in some of your stuff? Is some of the programs saying like get out, go for a walk, go for a bike ride, go for a swim, like go golf, whatever it might be? Like how does the fitness aspect of this, getting those endorphins rolling, fit into something like this? I know it's a general statement, but I mean, it just seems like if you get your pump on, things are going to go a lot better, right?
Absolutely. And, this is rooted in science, in that when we're focusing on our physical and mental and emotional wellness, that we will have positive outlooks on everything, on life, and on expectations on ourselves, and are able to perform at all levels even better. But what we're seeing with the pandemic is that when there is a disruption in our routines, when there is a disruption in our ability to do the things like we did before, the exercise, the physical activity, the regular sleep, and even socialization, and realizing that as human beings, our socialization with other colleagues, with friends and family, really contributes to our health and wellness, and contributes to physiologic supports like endorphins and really just positive outlooks. When we have the opposite, and we have strategies and circumstances that are pushing us away from those feelings or opportunities of independence, not being able to physically go out, or not being able to be in the presence of human beings, one-on-one, eyeball to eyeball, and to be able to read body language and to enjoy that interaction, it really has the counter productivity of causing us to go down, that hole of uncertainty, and that hole of not being well and not being as healthy as we can be physically, mentally, emotionally, socially. So so anything that we could do for self-care, as you noted, the exercise, the resting, the getting the 6 to 8 hours of sleep, whatever your particular body needs, drinking the right water amounts each day, eating healthy foods like vegetables and foods rich in antioxidants, and also conversely, avoiding some of the factors that can tend to cause harm, alcohol, smoking, other substances, in small amounts may not be harmful. Yet we all know that when someone is consuming those substances in higher and excessive amounts, that could definitely cause harm to the body, to the mind, and to social interactions. And recognizing that some of those individuals who are consuming those substances in excessive amounts are likely suffering from a chronic illness that we know is addiction. And as we are having it normalized that addiction is a mental illness and it is a chronic condition, that once it's appropriately identified and started to be treated, then it can be maintained, and it could be handled, and it could be managed in such a way that it will not disrupt someone's social life, their personal life, or their work life. But we have to acknowledge and recognize that when there is something wrong, that we need to professionally address it, and identify whatever the condition is, and in that case, addiction. But again, recognize that all of this has highlighted that many of these chronic illnesses and chronic conditions are preventable. And if we prevent them by looking at health and wellness and prevention and focusing on those strategies, then hopefully we can identify them early if there is a pathology or if there is something wrong. So, for example, if someone has an illness like asthma, oftentimes they will have it diagnosed early once it's appropriately uh, identified and certainly eliminated from other illnesses that might be causing shortness of breath or fatigue or chest pain. And once it's identified and treated, exacerbations can be prevented, and people can have a normal active life full of exercise and activity with the right preventive measures, the right medication, and the right strategies to treat it early once it starts to get out of control. So there are so many opportunities to know how people of different ages can stay as healthy and well as possible, but also know that as we get older, naturally some of the conditions that are in our genes that we may have inherited from our family, conditions that could be exacerbated because of our personal activity and the personal choices that we make, whether it's physical activity, nutrition, substances that we use, etc. I mean, all of these can be factors that, if they're having positive influences and prevention, could allow us to live healthier lives and really live longer. Whereas some of the factors that could negatively impact our life could have adverse health impacts and cause premature deaths. So again, understanding and appreciating our individual roadmaps for health and wellness, and what is it that we can do to be as healthy and well at this stage in our lives, and what to expect as we get older. And that's where primary care offices, doctors, nurses can be very helpful in providing that information and education.
Well, it's interesting to me how you can be born, or something can be passed on genetically. And then
Mhm.
when you want to start a business, I think Elon Musk refers entrepreneurship as like chewing and swallowing glass, and you have to have pain tolerance to withstand that day in and day out. And it's really, really tough. And you need to be like this type A. You got to be the cheerleader. You got to sell everything, or else no one's going to believe in you in order to buy into your business. And next thing you know, you're like totally isolated yourself, and then you're susceptible to something that you didn't even know that you were susceptible of having.
Hmm.
What do you tell business owners, entrepreneurs, and then you throw COVID into the mix, and then it's just everything is just the world's just collapsing on you. What do you do?
Hi.
Zach, I was gonna say, Zach, did you want to add to that question?
Well, eating glass, is that what you said? That was
Yeah.
interesting. Like, wow.
Yeah, Tim, I would say there are so many things that people, especially CEOs, leaders within organizations, can do when they start to realize that so much is out of their control, and this is the situation that we have today, right? And I think one of the things they could do is, first of all, take care of themselves and realize that they had a business and they started a business to provide a service or to relay a program, or to really have an opportunity to work with people for a common purpose. And when something outside of their control and outside of anyone's control happens, how do we cope and how do we become resilient? So recognizing that this is out of everyone's control, and realizing we have to take care of ourselves, but really taking the opportunity to ask other people who are in this space. So, just being involved and connecting with others who are going through the same situation themselves. So, definitely other employees, and just asking how things are, and start thinking about, what are some strategies that we've done in the past, or that we can start to think of together collectively to assure that our employees are okay, mentally, physically, economically, all that, but also start to connect with other business owners to say, what have you all have done? What is available in terms of resources, or understanding of what are lessons learned from other circumstances like this, right? So, for example, this was not the first disaster that has hit us. It's probably the first global pandemic that's hit us since the Spanish flu. But we've had, hurricanes, we've had, flooding, we've had, other circumstances that have paused us for maybe a day, maybe not for a year and a half, but maybe for a day. So I think business owners have access to information from their professional organizations, from other, business owners from around our region, and simply just their employees, right? And those, and even their customers, finding out what's different. So, I think entrepreneurs in particular are probably the best skilled in terms of flexing and pivoting and looking at, what else is out there and starting to throw things on the wall to see what might work. But I think, what I would like to underscore is the critical importance of making sure that they're healthy and well themselves, right? And realizing that this is going to be a marathon to recover, and lots of short sprints in between, but a marathon. So how do we start to look back and reset and refresh everything related to the business, and from the goals, from the objectives, from the product, from the delivery systems, from inventory and all that. I mean, every aspect of businesses are being evaluated. And then to have the opportunity to say, for the businesses that have struggled and have had to be forced to close, oh my God, doesn't that break our hearts? But rather, how can we learn from them as they have had to do their maneuvering, and hopefully looking at where the market is going to go in the future? Where is the puck going to go from here? And where is the pandemic going to leave us? And again, with all the uncertainties that are out there, how can we start to look at what is the population going to need? What is our business going to be able to do that we did before, but maybe delivered in a different way? Or what are some ideas that are going to be coming now, from the internet, from, conversations, to say, what are our gaps that are out there that now we can pivot to, leverage, at that time. So again, I think it's letting the entrepreneurs and the businesses start to realize there are always going to be opportunities, and the entrepreneurs are going to find it. And I think the more that we could maybe have those forums or those conversations to say, what is it that we can do together, and anticipate that, because COVID-19 in particular, we're still learning about, how do we anticipate again and learn from this experience to say, what is the next big emergency circumstance? Another pandemic. Oh my God, if we don't have to go that way, we hope we don't have to. But a public health emergency, or another economic emergency, or geographic emergency. I mean, what other circumstance can we prepare from and learn from, so that we could be more resilient? So there's, I think, a lot that we can have our businesses talk about, but also take advantage of, where the new needs are going to be.
It's clear that COVID was different than a hurricane, losing employees, stuff like that. But it is similar in a way that you can learn from it, right? So every year someone's going to put out a disaster plan for when a hurricane hits, right? Now, obviously that hurricane lasts a little bit longer, but it is interesting to kind of look and reflect back at that and say, you probably know what to do, you're just not doing it. And as you were talking about kind of different departments on, you have your finance department, your development department, your and several other departments in a business, or as you're kind of putting together kind of your business plan, there isn't anything about the individual wellness of the founders of the business or their staffs typically. And is that something that, and with business over the last decade, I think in Hampton Roads has really become a more popular thing, where people are looking at it as different than maybe the decades before. I don't really know how to articulate it, but it seems like a lot more exciting about business in the last decade. Like, is are you seeing stuff around kind of businesses start to include themselves, their teammates, their founders in kind of the mission statements, the business plans of the world? Or how are you seeing that kind of move forward? Because it's interesting. I think it's important. And I think it's something that a lot more businesses should put on there, because when they go through, the roller coaster ride, it might be a little bit easier if they can just, drop and do 20 push-ups through all of that.
Yeah. And what's interesting, Zach, is I'm sure regions across the country have done this, but in our region here in Hampton Roads, Eastern Virginia, there was an effort with several business organizations like our Hampton Roads Chamber, our Hampton Roads Workforce Alliance, that really came together and recognized that they needed to, really just kind of prop up their fellow business colleagues by simply understanding what was happening and to prepare for recovery, right? And as part of those discussions, exactly what you're saying about how do we start to realize that the health and wellness of our employees and of ourselves as business leaders has to be weaved into whatever we start to do moving forward. And I think what has been really fun with some of the Recovery 757 resiliency plans and recovery plans is that the human resources departments and whoever is fulfilling the human resources roles within organizations of all sizes are starting to almost celebrate, I think, because what they have been trying to advocate is the idea of health and wellness through, health insurance or through maybe wellness plans that they've been and wellness programs that they've been trying to foster within their organizations, probably for years, right? Because obviously healthy and well employees will lead to more productive employees and fewer days missed from work, or even for their children. If there's health and wellness promoted throughout the family, then there are going to be fewer days missed for school for kids that have to be out sick. So I think what the pandemic has done, because of how prolonged it has been and really shifting everything to remote and distance activities, has really focused on the critical importance of health and wellness through the business, and for businesses now to really be looking at how are we fostering health and wellness through the programs that were already in place, and what are the policies looking at. And as we've discovered through a lot of this, things like mental health and behavioral health coverage is something that people are looking at within their organizations, looking at how to address childcare, especially with a lot of the remote learning that occurred throughout the pandemic, and how many parents were really forced to stay at home so that they could not only work but also help their children foster effective and productive learning remotely. And also looking at how businesses can provide resources or connections to resources outside of the businesses has really started to come to the forefront. So I think what the leaders of businesses are finding is that they're really having to look at how human resources is not only just looking at hiring and managing the employees. They're really having to look at the benefits and healthcare coverage and supports and services that are being available for their employees. And for those in particular that were already involving employee assistant programs, or were already focused on health and wellness programs like advocating, breathing exercises or fostering yoga, or, allowing for, some paid family leave time for, childcare or for other benefits. Again, I think a lot of this discussion is really starting to impact how businesses are going to be planning and moving forward. And as we're looking even at that whole discussion about employees, choosing where they're going to work next, with the effectiveness of remote access and remote learning and remote working, many employees now are looking at positions to see, could there be an option to be able to do remote learning or remote working, especially because virtual encounters and virtual platforms are allowing effective administrative roles to still be productive and to still be accountable, even if it's not within the same office space as some of the other coworkers, but rather having the remote workspace be at home in the office. So knowing that attrition and hiring are starting to be impacted by some of these other human focused factors, and looking at programs that might be supporting childcare in a different way, focusing on health and wellness a little bit more, focusing on mental health, coping, and having a safe environment to share some anxiety and stress. So again, I think this is really a time for businesses to evaluate where they are as far as some of those benefits or some of those processes and resources, and how they could leverage resources that are available that are low cost and no cost to them, that are really accessible for their employees and for themselves, outside the organizations.
Yeah, and I think that that's one thing that I hope that people would understand, or be more willing to acknowledge the fact that it's okay not to have all the answers. You don't need. No one expects you to know everything. You don't need to know everything. So when you're going through some uncertain times, not knowing, it's okay, and you can show that vulnerability, and you can reach out to people that you talk to on a regular basis. I mean, Zach and I became very close because we would cry on each other's shoulders, figuratively, because starting a business is really, really tough, and so we would bounce, hey, what worked for you, what didn't work for you, and that's how we got through those things. I mean, like, how are we going to make payroll this time? What are we going to do when we have to let somebody go that we don't want to go? And I mean, those are all really difficult things that you have to go through, and it's okay not to have those answers. So then you combine that with there's just the negative stigma of mental health. I mean, it's just, I wish that there was a way that we could rebrand that, and maybe there's efforts to do that. But it's like, you have cardio strength, and you have muscular strength, and you have networking strength. I mean, this is about exercising your mind and becoming stronger from that mental strength standpoint. I think it's a good thing to go out there to try to strengthen what you're capable of doing from a mental state. And I just wish there wasn't such a negative connotation.
Well, I think it's negative
that.
even just everything. Like we were talking earlier, is that the Virginia pilot released a thing about 3 new restaurants that closed due to the pandemic. And it's like, look, is this like, what did you guys do to support those businesses on the opposite end of this? And so like, oh my gosh, these 3 businesses closed. You're right. But you also weren't there for their opening ceremonies. So like, bad on you for playing this game of clickbait of, oh, let's talk trash about these businesses who closed, who actually, put everything on the line to stay open. And yet you think it's cool that we're going to put this negative post up there. Yes, I get it. It's news. It's the truth. They closed, and likely due to the pandemic. But again, did you do everything from a journalistic perspective? Did you do everything from a media capability to actually then go promote that business, or are you using it on the negative side? And that's something that's so silly and small, but it's like Tim said, it's all negative, and it's all negative. So then when people are looking for this help, they feel like, oh, well, I don't, and it's aggravating.
Yeah, the thing that I wish that, like, so bringing everything back around from a business owner standpoint, I mean, one of the benefits and one of the perks, I mean, that I wish that would be offered today would be like, hey, go talk to a counselor proactively. Don't wait until things are really, really bad, and then you have to talk to someone to talk you off the ledge. I mean, people offer gym memberships and memberships to this group and that group. I think that it's something that would be really, really great. It's a great benefit to have, and I wish that was offered.
And Tim, you mentioned that stigma, and how there just seems to be a lot of just tension out there. And again, before the pandemic, there was a lot of stigma about mental illness and just mental health in general, right? But I think the way we continue to work together to dispel the stigma is to continue to normalize it, right? And to recognize, you know, just truly, everyone has been impacted mentally and probably financially and socially from this pandemic. It's just everybody has been impacted differently, right? And I think the more that we have these type of conversations to say, you know, it's not a matter of if you were impacted, it's a matter of how. And I think the more we can continue to, you know, talk about it and to say we need to help each other. We need to do like what we're trying to do at EVMS and instill that culture of humility. And like you said, you know, and previously, that we don't have to know all the answers, but you know what? We can be human beings and be sensitive enough to recognize that we're all hurting, we're all grieving, we're all suffering. And as we are all trying to, you know, figure it out for ourselves, figure it out for our businesses and organizations, and figuring out for our society, let's try to be as positive realistically as we can be. And again, we can only control our own behaviors, right? But could we foster that sense of positivity? And again, Zach, you're so right. You know, could we all be looking at when there is something negative that happened? Could we have done something differently? Could we have propped up and encouraged, you know, something or someone, organization, you know, so that tough things like closures do not happen or loss of jobs do not happen, you know? And again, I think there's lessons learned from this experience of communication of information, miscommunication of disinformation. I mean, there is so much that we can start to scrutinize and say, is this really the right thing that is happening? And to not just take things as face value, but rather start to ask, what else can we know about the circumstance? How else can we help? What else could we have done to prevent? And who else is suffering now that we might be able to proactively reach out to and support, right? And I think that the more that we can try to counterbalance some of the, you know, negativism and some of those, you know, messages that are causing fear, how do we promote some of the truly hopeful stories, the human stories of helping and focusing on, you know, the great things that children or teens are doing, great things that seniors are doing, great
Why do
things
you
that
think that stuff doesn't happen? Like from a news perspective, like I bet if I was to say, hey, why are you guys running your negative thing? They would say our data says that more viewers want to see the negative stuff than the positive stuff. They want to see the negative things surrounding them. So that's what they would say, right? But why aren't people gravitating towards the positive in this sense? Because they sure do seem in the comments pretty ticked off at the stuff that they're seeing. Like, why don't we see the gravitation of the positivity in the way that you're saying? Because I'm with you. I know Tim's with you, right? That support staff is there from a positivity standpoint, but why don't we see that in the masses?
You know, I would say that's probably human nature, right? Where we tend to gravitate towards the surprise. We're gravitating towards the, you know, we can't stop watching some of the things that are negative. But I think it's part of our psyche where it's easier to process and almost get into that that negative, that disappointment, and you know, oh my gosh, okay, well, there's nothing else we can do. That helplessness. But I think if we look at especially entrepreneurs, right? They're the ones who are always optimistic that things could be better. And if we could start to really pattern and be consistent with, you know, really countering what is being propagated in the media and what's being perpetuated on social media, I think we need to have that positive and optimistic revolution to really focus more on knowing that it's the optimism that is going to carry us through this. And, you know, there's no silver bullet. I think we just need to make that positive commitment to say life happens, and we know life is not always rosy. And we know we're going to get older. We're all going to get injured. Accidents are going to happen. But can we start to agree that in order to get through all that, and in order to overcome some of those challenges and hurdles that we know life is all about, how do we really focus on, that hopefulness and, the positiveness and the optimism that we know, make us on a day-to-day basis, but may not be getting into the headline news, because that's the nature of that business. But how do we maybe advocate and spread, the spirit of happiness and hope and wellness, and faith in each other and faith in the system, and to start to elect leaders that have that same sense of, wanting to, disrupt the cylinders of excellence, and want to disrupt the institutions and the systems that are creating and perpetuating the negativism and the divisiveness, right? And I know it's easier said than done, but I think we all just need to make that commitment,
Yeah.
and to start to in the venues like you're already doing, really elevating and sharing, many of those positive stories that
Well,
will
one
make
thing that's interesting that as you're talking about this, leveraging technology that I use to help positive, me being positive when I'm writing. So if you the tool Grammarly, a lot of people
Mhm.
use it just to make sure that they're using their
Mhm.
punctuation correctly. But one of the parts of Grammarly, it actually analyzes how you write, and every week it sends you a report that, hey, this percentage of your writing was happy, this was direct, this was angry, this was encouraging. Before you post anything or before you publish anything, it will analyze whatever you're writing, and it will tell you, hey, this is direct, or what type of tone are you looking for when you're writing this. And it's, to me, it's a fascinating tool to use, and I always try to keep everything positive and uplifting and encouraging. But
Mhm.
that's just one of the tools that are out there that people can use to help with that. And to Zach's point, I mean, is you see all these businesses that will post and they don't get a lot of engagement. But boy, when they post something out that they're closing their doors, and then it's got all these shares, and then everyone comes out of the woodworks. Oh, I love that place. And it's like, well, where were you when they
Mhm.
were open? They needed you then, and now it's too late. So
Mhm. Mhm.
yeah, spreading the word of positivity is it's tough.
It is, and I think it is our opportunity now, as you all have um, acknowledged that we're in a time where all of us are going to look back and remember that this was really a time of heartbreak, but also what are the silver linings, as many people say. What are the things that emerged that came from, this circumstance and this time? First, I would say this allowed us to acknowledge how much we need each other, how much we are human beings with, hearts and minds and souls and spirits that benefit from each other, and are truly wanting to reconnect and be in the presence of each other. So I think that's a positive. I think the technology, medicine was struggling on how to advance healthcare through, technology, such as, virtual platforms, and boom, the pandemic pushed us into that realm so quickly. And now, hopefully this will continue, and it'll continue to be an efficient and effective way of delivering, services, medical services through telemedicine, telehealth, education. And, we've also realized that, there are strategies and businesses that succeeded throughout the pandemic. But what we've also realized is that, lessons learned, that there were disparities there, you know um, differences in health outcomes that were preventable before the pandemic, and they were exacerbated during the pandemic. So how do we look at the systems now and set things up so that we prevent those disparities, and prevent people from getting sicker, or prevent people from being more disconnected, and realize that there are many brothers and sisters of ours in communities that are under resourced, that we could do better to help them. There are people, within our organizations that, were seeing unemployment or having to go to food banks or to food pantries that they never had to do in the past. And how do we, set up a system so that's not going to be the case after this? And, how do we start to look at, you know, mental health and wellness, and how do we keep ourselves healthy? How do we keep ourselves well? And how do we, incorporate into our daily lives those strategies to breathe, those strategies to include physical activity, even more so. And again, I think there are going to be so many other lessons learned from all of this, but I think you're right. How do we leverage the alerts so that people will
Yeah.
start to act, not at the last minute, but be able to say, oh my gosh, how can we rally together and save that business before they close?
Well,
When we
one thing
see
that's interesting that before everything started, my wife worked from home, and I worked at an office doing my thing, and so she would be home all alone all day. And then when I would get home, she was ready to go. She just wanted to talk to somebody. And then I was at the office, and I was like, I've used up all my words for the day. I don't have any words left to say, and I just need some alone time just to kind of decompress. So I see that that's going to be like kind of the next unknown thing that people don't see coming as people start to go back to work and other people stay home from work. And how do you balance that too when people just want to talk to someone and then some people just want to decompress? I mean, it'll be interesting how that works out.
exactly, and I think what we've learned is that this is really pushing us to set expectations at the get-go, right? To be able to walk in the door and say, you know what, I need 30 minutes just to decompress and to breathe, and then you'll have all my ears and attention, right? And then the other person will say, oh my gosh, I'm going to need to talk with you just to get some human interactions, and to say, but when can I do that? And to set those expectations that instead of jumping, we have to kind of anticipate, okay, let's understand each other's needs first, let's figure it out, and then really set that time, right? And I think what we're doing is getting out of our comfort zones of assuming, all of us are kind of assuming what our loved ones, what our coworkers and what our, neighbors, are going to be expecting. But I think we have to, start to really articulate those and set those up front to say, here's what I will need. And then let's assure that we can help each other meet each other's needs, and again, I think really pushing us to communicate and almost over communicate what it is we're trying to get. And I think, again, realizing that as we are moving forward and starting to redefine and re-engage in social encounters, what is that really going to look like? And how do we again take advantage of the fact that we've been so disconnected? How do we start to say, you know what, we as a family, even as we get back into a new normal, how do we assure that we reconnect? How do we set the time to reconnect as a family without technology, but potentially leveraging technology? How do we reconnect? How do we start to, come back to the workforce and say, yeah, we've got to reconnect socially as employees, but how do we really be productive with what we're supposed to be accomplishing with our work objectives, et cetera? And how do we, re-encounter and regroup with each other at a faith-based organization, and to do it safely? And how do we assure that our neighborhoods are re-engaging and setting the strategies about supporting each other and recognizing, who might not be coming out of their homes, and should we, knock on the door and just make sure they're okay, and set the questions up to really ask, do you need any help with anything? How else can I help you? And not just the generic, are you okay?
Be a good
How?
human, right?
Yes, exactly,
Be a good
exactly,
neighbor.
exactly.
Yeah, so the Brock Institute EVMS, like how does a business, if I was a business in this area, or if I was listening to this and I'm interested in the things that you've been saying, how do they get involved with you guys?
Yeah, I will say definitely paying attention to some of the activities that we're hosting across the region. We are partnering with the Hampton Roads Chamber and other organizations such as Centera Healthcare to look at how businesses can be prepared to provide resources at low or no cost for their employees, but also to look at how they as businesses can produce and create a culture that is sensitive to these type of issues. So just knowing that we are going to be hosting activities, summits that will foster these type of health and wellness focus. We also have a website where we have information about some of our prior activities that we've done. And we're also advocating and sharing websites related to our partners that are available to help provide information for your employees, such as the National Alliance on Mental Illness, a wonderful organization that was created for families and people, individuals, organizations that actually have people who've suffered from mental illnesses all their lives, and to be relatable and available to talk to those who are suffering. We also have, Mental Health America, which is a national resource that is available for organizations and individuals to tap into national resources, the surveys that I mentioned, the tests for looking at anxiety and tools, surveys for people to start to really question and assess whether they might be suffering from anxiety or depression and where they could go or who they can talk to thereafter. And then certainly recognizing that the VA, the Hampton VA Medical Center, and veteran organizations across the country are recognizing that veterans were at risk even before the pandemic, to be at risk for suicide, and recognizing that every day there are 20 veterans approximately that are committing suicide across the country. And many of those, probably two-thirds of those, were not connected with services either at the VA or in the private sector. And could we be helping recognize veterans within our own organizations that could be connected to services and could simply be supported just by nature of being veterans, just being sensitive enough to what they and their families are going through. So again, just keeping an eye out for what the Brock Institute is going to be hosting as far as organizational summits and conversations related to this. And again, connecting with local chambers and other business organizations that are going to be addressing this through their own human resources and their own networks, to say how can businesses really start creating environments in order to address and support coping, addressing anxiety and depression, but also connecting to resources when there are more serious circumstances.
I'm interested in your take on social media, period. I mean, I mean, on one side, you have all the people that are just posting the best lives ever. I mean, like they're on vacation, and then other people that are in a dark place, they see that, it puts them in a darker place. Social media is still pretty new. We don't know the full effects of long term, what that has on people. I mean, what is your take on social media?
I think social media is being more and more adopted as a primary source of information. And I would love to see everyone take advantage of posting really more positive messages, more positive tips and tools and strategies, but also throwing in some questions that link to resources and tools and strategies that can help people that may be, again, using it as the initial point of information. So I would hope that those who are using it will want to advocate for and push for more positive messages, and really take advantage of having that be the venue for true helpful information, but also to leverage that for raising the awareness to say we really need to help guide people to credible information and resources, especially to prevent further misinformation or disinformation from being spread. So I think it is an opportunity, but I think it's something that's going to be here to stay. And we just simply need to strategize together on how we
Yeah.
can use it for the positive and for the effective and productive.
Right, it's just such a simple solution to tweak the algorithm. Right now the algorithm's tweak that negativity is going to be the most seen stuff, where it's like,
Mhm.
and they choose profits over positivity. If they would just tweak the algorithm a little bit the other direction and be like, hey, you know what? We've made enough money. I'm whatever the Zuckerberg is, the fourth richest person in the world. I've made enough money. Let's tweak the algorithm and
Maybe that's
promote a
not
little
enough
bit more
for him.
positivity. How
Maybe
much do you need?
he wants to get to number 2. I mean,
Right.
what's something we haven't talked about that you want to talk about?
One last thing, as you guys were just talking about, was just the importance of just nutrition, and recognizing eating truly an apple a day can help keep the doctor away, but it can also
Would
be
you
a good
say an
source of
apple fritter?
fruit. Was that an
Eating
apple?
an apple fritter a day keeps the doctor away?
Well, we have to be careful, because sometimes, even just when apples are part of or an ingredient of a dish, it may not have its positive effects because it's,
Yeah.
kind of overlaid with all the sugar and other things that are not as good or healthy. But just recognize that nutrition is a critical piece of helping keep people healthy and well, both mentally, and physically. But that nutrition is really an underestimated strategy that could impact how really healthy and well people are. And so just want to emphasize, really an apple a day and a glass of water, 8 ounces, 8 times a day. Really what we learned in elementary school and middle school really does bear positive impacts.
An apple a day and an apple fritter a day will keep the doctor away. You heard it
And
here from me, not from you.
that's right, Anna.
It is interesting how things that we learned as kids are really the way to live, yet we throw it away and are like, no, let's not do that anymore. So, but all right,
Exactly.
it's been great. It's been wonderful. Thank you so much for your time today. Looking forward to catching you out in the wild at some point when you guys have one of your events. Looking forward to being there and watching that. And thank you so much for being on here today. And we look forward to continuing the conversation.
Absolutely. Thank you so much for having me. Really appreciate
Thank
it.
you. Appreciate your time.
Have a great day. See you guys all soon. Cheers. Peace.